for joining me today. This is something new that I'm starting, but I thought it would be a nice way to introduce some new exercises to people who are already familiar with the balanced matter system, and then also just look at some of the principles that I've been doing. My name is Erica DeMart. I am the founder of Step and Connect, and I invented the balanced matter system as a physical therapist seeing a need for my clients, initially with Parkinson's disease. I'm going to show you some cases and some clients that I've worked with looking at turning. But I really would love the one part for Step and Connect is to give the education and the tools. So if there's questions that you have with your clients, please let me know. And then one part that I love as I'm meeting more clinicians around the world using the balanced matter system, it's neat to kind of see what everyone else is doing. So to connect you with other clinicians and see the creativity of what other people are doing. So let's get started. And let's see. So one thing that I do in my course, and I think it's important even to do with our clients, is to do some discovery learning, kind of figure out how we're moving, how our balance can change by doing different things. So we're gonna try to make it a little interactive right now. So if you want to stand up, if you have a balanced matter system, you're welcome to pull it out and try it if that helps you learn better. If you, these principles can be applied even without the balanced matter system to understand what your clients. So if everyone can stand up and thinking of looking at the temporal and the spatial parameters of movement. So maybe your client is always moving at their comfort speed. How does their balance change? So if you stand up here, I'm on the balanced matter, the clicker foot pads. What is my balance when I go really slow? And you could do this eyes closed or eyes open versus your comfortable level, and then really fast. So I want you to play around with first just the temporal parts of movement, changing your different speeds, and then the same thing, maybe moving in a medium step, a big step. How does that change your stability? Because sometimes our clients, if we're having them exercise at one speed or one size, that's not going to actually relate to everyday life. We need to be variable in our practice. So you're welcome to just kind of play around with the temporal and the spatial parameters of movement, and we're going to really apply that for turning today. But I think that could even be a circuit. Right, so having somebody stand on the foot pads or have them even without the foot pads being marching in place and doing different speeds and seeing how that feels. So since some people are still standing, I want you to think of, we're going to do this next exercise. I want you to think of the variability in practice. This is important to add the amplitude, the movement time and speed, your dual tasks, sequencing, direction of movement, feedback and cues, surface and force. So we're not going to go over all of these, but we're going to definitely go over a few today to see how we can implement that. So I'd like everyone to, if you're sitting in a chair, this is going to be the easiest in a chair, you're going to stand up and walk around your chair and then come back and sit down. So if this is your chair here, I'd like you to stand up and walk around it. I have a small space here, and then come back and sit down. This is where I'm actually going to see if I could see more people so I could see what you guys are doing. All right, so when you did that, what did you observe? Did you have, or if you were watching somebody do this in the clinic, what was your observations? Did anybody think of what leg they started with? Was that something that you paid attention to? So if you're looking at your strategy, do you start, if I was doing a step strategy, and here I stand up and I'm turning to the right, I would step with my right foot and then my left and then turn around. If I was doing a spin strategy, I would stand up, and even though I was going to the right, I would initiate with my left leg. Do you see how that would change the different strategy? So I'd like you to try it again if you didn't pay attention to what leg you started. This time I want you to pay attention to your head and your eye movements. So I want you to try again to walk around your chair. You can think of what direction, maybe you always went to the right or to the left. And this time you're not allowed to move your eyes or your head. So see if you can turn around and walk around your chair without moving your eyes and head. How does that feel? Did that change the number of steps you took? Think about some of your clients who maybe turn and block and don't initiate with the head. We're going to talk about this, how that plays effect in your balance. Now let's look at a narrow base of support. So you're going to walk around your chair again, but this time you're going to walk almost tandem. So you're going to walk one foot in front of the other with a very narrow base of support as you walk around your chair. So let's try it one more time. If anyone's getting dizzy, let me know. So what happened to your center of mass there? Did you feel like you were falling towards the inner part of the circle? Did you feel like you had a good control over that? Were you able to break that acceleration? So all of these factors can change how somebody turns. So this is something that if we're going to do a circuit or training, we need to be looking at our observation skills of what we're actually assessing. So I would love everyone to, this is where I wish it could be more interactive if we were in person. But if you want to write in the comments, think about what cues and feedback do you provide to clients that want to improve their turning? So what do you do to help turning? So you're welcome, like I said, to add in the chat or just think about it and we can talk about it at the end, but that's what we're going to be talking about today. So why are we even doing talking about turning? This is very important. Recently, I've had a few clients who it is their goals because they've had falls with turns, and we turn more than you might realize it. Look around your room right now. How much of your room is a straight path versus a curved path versus 90-degree turns, maybe 180-degree turns? So this is what we do every day. But besides just regular turns, we need to look even more at it. Sometimes we have I can walk and turn and go walk to my bathroom. But what happens if all of a sudden my dog is doing something and I do a quick turn because it's unpredictable and I didn't know that something was happening? So we have to look at both, because if we're just training predictable turns 90 degrees and our client loses their balance at 180 fast turns, then we're doing them a disservice. We need to be able to train what they need to be working on. So this just kind of shows you my thought process a little bit of when I'm training somebody for turning, I'm looking at all these different factors. So I'm looking at biomechanics, looking at their axial mobility. If they don't even have that neck rotation or that trunk rotation, how are they going to have that segmental coordination to be able to turn? What is their strength of their gluteus medius muscle? Do they have that stance stability to be able to stand on one foot for a longer period during that whatever direction they're turning? What about the spatial parameters? Do they have a wide or do they walk in a narrow stance? Speed, we talked about how fast they're moving, the timing, the rhythm. Also, we're going to be talking about sensory integration. Are they able to use their visual system, their somatosensory system? So all of this is important. And lastly is psychology. If somebody had a fall during a turn, especially in a certain environment, are they fearful? There's research, I put the one article in the bottom there, that when somebody is concerned about falling, their segmental control is changed. They're not going to have that segment. They're going to start moving in block because they're fearful. They're going to change that strategy. So this is something for any exercise that you're going to be doing. So the Balance Matter system, I'm going to show you some exercises with it, but it's just like you would and it's a tool, right? So you're first going to determine your goal, what kind of turn, or if that's going to be what we're talking about today. Identify, well, what's wrong? Why can't they turn? Is it control of center of mass? Is it because they're fearful? Is it because they have decreased stance stability? And then what kind of assessments are you doing to look at that? How are you training it? And then how do you keep progressing it to make it more difficult for them so that they can generalize that to everyday life? So turning starts with our head and our eyes, right? Because if I am about to turn, I want to look at my visual path, what's ahead of me, to be able to say, hey, this is my new information of, is there obstacles? What's that future walking path? If you don't turn your head, you can't anticipate that. But this is an anticipatory motion our eyes just automatically do, or they should be looking head, trunk, and then step, right? So that's the motion. It's this top-down segmental approach to reorient our body to a new position. Think about though, then the vestibular system, right? So our eyes start it, but if you can't stabilize a quick head turn, how are you going to be able to, you might not turn your head as much then, right? You might slow down because you don't want to integrate that part of your body to be able to turn, or maybe it causes you to get dizziness. So then you're going to do that unblocked turn. So there's an integration of all of the sensory systems. Proprioception would be how can you adapt and keep changing that step length? Can you change a step width and step length? So I'm going to show you a few examples of how you can incorporate the eyes to get that segmental control. So this one is a video, and I'm showing a few videos from some groups that shared videos with me. So this is from Kansas, from the Parkinson's Wellness Center, and they were using the mat, and here you could see the two lights. So if you go actually to my podcast on my website, there is a really good podcast on saccades and locomotion with a neurooptometrist that I interviewed. And we talked more about how the eyes can actually help, and how I didn't even realize there's, I think, 7 different types of saccades. So if your voluntary saccades are not working, it would be more reflexive. So if you have a light that shines and just pops up, your eyes are going to focus and look at that light, and then your body's going to turn toward it. So I'll show you this video. It's really, I just made it short to show you. So right there, he has a 45-degree turn and a 90-degree turn. It's the placement of his foot pads. So you see there's 2 clicker foot pads facing forward, and then they're both in different positions. So when he sees one light, then he's going to turn his eyes to hit that light and then step to that coordinating part. If he saw the other light, then he would go to the 45-degree one. So you can really switch it. And I think she even added, if you saw red, then you can do some inhibition exercise if you want to add that next part to it. But this is a nice way to be able to initiate the eyes and then have the body turn. So again, instead of having that block, you see that segmental motion. The one thing that I would recommend if you're doing this is to have another marker. You can't see it in the video, on the wall that is facing straight, because then the people tend to just keep their head looking that whole way and waiting for it, because you want their head to turn straight and then back and forth. So I would actually have this set up with 2 of the lasers or whatever, if you have the blaze pods, whatever type that you're using for lights, and then have 2 facing forward.
Hey, Erica, I'm sorry to interrupt you. Could you let Connie in?
Oh, sure. I didn't see that.
Thanks.
Thanks. Yeah, please unmute yourself if there's stuff that you guys need to know. So the reflexive saccade here, I did it in my group exercise class. So some people use the mat for proprioception. Some people just did it for looking. This is for a group exercise class for Parkinson's disease. So attention and how big they scan the movement was also an exercise for this, for these clients, because just like they might take smaller steps, their eye movements, they might not be scanning as big. So this was a big gym, and I had a red and green laser light. So you'll see. And then here is my daughter and my mom actually having a fun time together working on exercises. And she was putting the different colors, and she'd have to match the color to the foot pad. And again, this was an unpredicted, she didn't know which way she had to turn. And she's trying to tease her to go the same time. So here you could be working on, again, having the light in the direction of where that foot pad is, and then making it unpredictable. So they would have to be able to be looking for it, turning, and then being able to step. Really trying to get those eyes involved. So next, I want you to think of your center of mass when turning, that medial lateral stability when walking, right? So if you're looking at the step width, did everyone feel different when they had to walk around with a very narrow stance? Did you feel like it was harder to control your center of mass? It was like leaning inward. So how do you control that center of mass when turning? So I'm going to show you one before this exercise. One of my favorite exercises is using a hula hoop. And I realized I use hula hoops more than I realized. So if you use a hula hoop with the Balance Matter system here, one thing I find is if someone's turning, so let's see if you guys can see. I'm gonna just move this a little bit. So if I was placing this, I'm gonna place 1 foot outside the hula hoop. And if you had 2 mats together, you can also do it with 2. And you want someone to be able to shift. So if you notice right now, you can't see my head as much here, but in the hula hoop and then out of the hula hoop. Once in a while, when you see someone turn, and think about if they keep everything inside the hula hoop and they don't shift their center of mass out, they're gonna have less stability. So learning to be able to, my cue is head in the hula hoop, head out of the hula hoop. And then you're getting the clicker, so you're getting that weight shift back and forth. So that's something that you can be training. If you see somebody who tells you, you know what, every time I go around a curve, I kind of bump into the wall, I feel like I'm falling, or I'm kind of falling into my turn, is something that I sometimes hear from some of my clients. So here's another video from another client, another therapist looking at turns for somebody who had a stroke.
Oh, yeah. Better, much better. I'm not hesitant.
And think of that word, what she just said that I loved. She said, I'm not hesitant anymore. Because I think that's really important to think of that hesitation of your turning. And that was a 90-degree turn, but you saw that she had definitely a better weight shift in that second video. So each turn is not the same, right? So learning that there's different types of turns: spin turns, step turns, planned, unplanned, angles, speeds. So if you're making a circuit and you can have each of them, this is a step strategy, this is unplanned versus planned, having different angles. So think about, what turning strategy do you use? So that was a step. So you see she crossed over there for that spin, and here I put it in slow motion so you could see a little better. Right there, she's making a left turn, but she's stepping over with her right, but she took a nice wide step so it had a little bit more stability. And there, the next one would have been a curve. So knowing the difference between a quick turn versus more of that transitional walking. So spin turns are definitely less stable. If you want to even stand up again and practice and feel the difference between a spin turn and a step turn, it has more changes in your ankle inverters and hip abductor moments, greater range of motion in your lower limbs. So just really knowing what is your clients doing and what does it actually entail that they have to do for those turns. Also, there's research, and in the course I go into it deeper, and if anyone's interested, I can send more articles on it. There's articles that kind of are all over the place based on how much people are doing spin turn versus step turn. So some articles said that it's about 50% that people do, you know, a combination, but just kind of watch your clients and have a better assessment to say, hey, you know what, I'm noticing you do always a spin turn when you are going to the left, but a step turn when you're going to the right. This is where your observations will be able to help know what your treatment is. So here's another unpredictable. So think about the phone ringing or the doorbell.
Right.
So in this video, the lady in the video had a fall, I think almost 15 years ago, when she was walking and she was on a trip and somebody called her name behind her that was on the trip, and she was, I think, had a suitcase, and then she lost her balance and fell. So that quick turn, hey, and looked behind her and took a step is where she lost her balance. So that would be more of a static versus walking and turning. So kind of knowing what is it for your client and how do you have that unpredictable part. So this was a group exercise together. So he had to think of, call out the direction, right, left, put out his fingers while he was stepping. And then she had to turn, look at the fingers and be able to say how many as she was stepping. So here's, so if you are trying to make a circuit with angles, think of maybe your gym or your clinic that you use. You can think of having a straight path, looking at how somebody is ambulating. Maybe you're doing the timed up and go and looking at an oval path, having them walk around. There is some research looking at walking around different height obstacles also changes someone's stability. So really thinking of what their environment, where do they have less stability when they're turning. Doing a spiral between cones versus a figure 8 pathway versus sharp turns. All right, and then once you know that they can do whatever walking pathway that you're doing, then you would add these next components. You'd be adding maybe a ball carry or tossing a ball to a partner while you're walking, or head turns or visual search while you're doing it. So you can keep adding those components or adding different surfaces that they're stepping to. And again, vary your speed. So here's some tests that most people are probably familiar with. The figure of 8, we're going to go over in a moment. But also think of just your custom clinic turning course. This was in an article that they actually just did this for mild traumatic brain injury for return to duty assessment. So they had it very task specific, but some of these sharp turns looking at different angles. So thinking of what you maybe use in your clinic already, or maybe some of your assessments, and then how do you have that into your exercises. Just to let you know that the tug actually, when older adults, so speed is usually a predictor, right, for falls. If someone has decreased time, increased time in the timed up and go, they have a higher risk for falls. The turn at around the cone and then actually approaching the chair to turn and sit down was where people were the slowest. So if you actually break it into subtasks of getting up and stepping, the turning, and then coming back to sit down, if you look at those 4 subtasks, it might actually help you improve their time versus just saying, I need you to get faster. So really look, is it they're turning? Is it approaching the chair? Is it getting up from the chair, that initiation, that first step? Because that's going to be more specific in how you can improve in your outcomes. So here, I don't know if you guys want to write in your comments, because I feel like I've been talking so much. Does anyone use the figure 8 walk test right now? I can see only a few, but I see a few head shakes no. So this is actually really easy to use if you set up with the Balance Matter system. You can put, let me see, I'm seeing not yet so far but here if you put the mark at it's 5 feet. So if you go to the 60 inches and put the 2 cones and put a little piece of tape, then you can walk away from it and move the, to keep it standardized, you would actually move the mat and have somebody walk around it. So I'm going to show you how it's done. Why isn't it going? There we go. So you're recording their speed, the number of steps, and their accuracy. How smooth? Are they hesitant? Do they pause? And then there's a norm range for fall risk. While you're doing this, I also look at the different strategies and types of turns and look at their step width and length also. So here, I'll show you this lady doing this turn. So you're going to stand in the middle of the 2 cones, then you're going to go around 1 cone and do a figure 8, and then stop right where you started. Go at your comfortable pace when I say go. Ready, go. So you're going to stand at the 30 mark with your heel. When I say go, you're going to walk around the first cone. You're going to pass the center and walk around the second cone and then return to the starting position. Ready, go. So I highly recommend if you're having trouble analyzing someone's turn, especially if they're walking faster, video it on slow motion. And then you're really going to be able to see their center of mass and see where something maybe is going correct or wrong. And you'll be able to see that spin turn a lot better sometimes. So when you're walking in a curved path, you kind of see the figure of 8. You're going to be having that. You're going to change that outer leg is going to be longer than that shorter, your step length in the inside leg, right? So you have to really adjust. It's not like straight walking that we have a symmetrical step length as we go. And that body, your center of mass is shifting toward that inner foot, having that increased stance time. So kind of looking if there is one side more affected than the other, you might start realizing the client might not even know that they always turn in one direction. And that's our job to start telling them, you know, we want to practice in both directions or kind of see what happens in each direction. Okay, so here, just to show, I took some still shots of her walking around here so you can kind of see the third picture. She's taking, she's turning to the left and she's taking a step turn, right? Initiating with the left leg. But then the next step, as she starts going around it, she goes right into a spin turn as she goes around. So just in the matter of 2 steps, it switches from step to spin as she goes. So kind of looking at how that can change somebody's stability. So, because if you're only practicing again step turns, that is going to be maybe not helpful for them if that's what they're doing throughout the day, or they need to be aware of that. So 180-degree turns, this article actually did a really good job of testing 180-degree and 90-degree turns and looking at predicted, unpredicted, and they changed and also looked at strategies. So here you could just have somebody turn at the marker, similar to the tug if you think about it, they're just walking and turning around. And then you're not telling them what direction. So similar, again, the tug, you don't really say, go around this part of the cone. They kind of pick which way they want to go, right? So here I have in the course, and this is something I've been using with my clients, is really having it to be goal directed. So, you know, what do they want to accomplish? Really empower and have them part of the process. And you'll start learning a little bit more about, you know, is it speed? Is it a type? Is it an environment? Where is their goal? And how important is it to them? And how confident are they in achieving this goal? Because if they're not confident, you need to know what are those barriers so that you can help them have a coping plan to overcome some of those. So this is something that I go over with my clients, and then we develop an action plan together with the exercises. So here I want you to watch another client who is turning in the kitchen. And I think this is a static stance. So seeing somebody, sometimes it's not always walking and turning, you know, right here, you're preparing something for dinner and doing a quick turn, that's going to also change. So look at her step. You're going to see before and after training, looking at the step width, because this is, and the coordination of head and trunk.
Good, and then turn back.
So if you see the head or the eyes aren't leading the way as much, and then on both directions, it was a little different strategies, looking at the stance and the swing phase of the turn. And think about how would you address that, or what would you be doing to improve the turning. I also like to use the NASA Task Load Index to look at how, and sometimes the actual app can be a little overwhelming because there's so many questions. I do like it that it gives you a number, but you can even just use the 0 to 20 scale as a quick scale, because when I did it with this lady, I think it was a little too much to go over each one. But one thing that was really important here, she thought the spin turns, when she did a spin turn, the temporal part was more demanding for her than the step turns. But the mental demand, she was a little bit more doing the step turns. So kind of looking at what they're thinking about during each of it. So this next part of her assessment, I want to see what was, since she wasn't turning her head, what is her stability? If she has a narrow stance, What is her stability with head turns?
How confident are you turning to look over your shoulder on a 1 to 10? For your balance.
Probably an 8.
8 as confidence, good. And then go to the other side. Good, now bring your feet all the way together. And then do it again and tell me what your confidence level is.
Oh, it's less 5.
5, okay.
So if somebody doesn't have confidence turning their head in a narrow stance, that's something that you need to work on incorporating the vestibular system to be able to improve their stability and have them change that strategy to have that more segmental coordination. So we worked on doing more of step turns to make it safe in the kitchen, so she's not taking as many steps. And then the next goal would be to start working on some spin turns. So here is after training.
So this is your step turns. Good.
And during that, she had 3 targets to look at before she turned. So looking in the mirror, you could see me video and looking at, different picture frames. So I think this is important to be able to have a visual, something to start training that segmental motion. This was that article I talked about, saying the 90-degree turn in a predicted direction, unpredicted, and then adding that cognitive load. So this is where the creativity of everybody here, where you could take it to the next level, as you have a path, and then you could put, somebody can say left or right, so it's unpredictable and they have to turn. You could be doing stepping left and right, having every time they hear a different color. So you can change that and make it more predictable in the beginning. And once they're getting that pattern, make it unpredictable. So here's another example. I think it's also important to, and you could do a lot of training, and we're going to do some other exercises in a moment, in coming out of a chair. So this gentleman, it's just an empty chair for a minute, let's see. So this gentleman told me that he was freezing when he was getting up from his table to go to the kitchen. And if you think about, if you just said freezing, getting up from a chair, or think of the clinic, if we're just testing somebody getting up from a chair and there's nothing in front of them, that's going to change the strategy of how they're turning or how they're getting up. So, asking some questions or asking them to video themselves in their environment, or if you can go to their environment, you're going to be able to see so much more. So this is a quick him doing it, and I'll show you what we did to improve this. So we'll do it one more time. So you see that quick step over, crossover step that he did in the first one versus the second he didn't. So here's just some still pictures. That first picture, if you look at how much he can abduct and externally rotate that leg to swing his leg over, he didn't have much room. So that second step, because all his weight is on that right leg, he's going to do a crossover step. There's research in Parkinson's that is decreased stability. You can see he's also looking down in the first one, where he's getting some rotation of his head to help with that movement in that second picture for the first group. And then even looking in the second one, he's having a lot more stability versus falling into it with that crossover step. So what we did, and we'll be doing a circuit, is if you're sitting in the chair and you look at how much hip rotation you have. So I set this up for him in sitting first, just to improve. So here, can he get some rotation and push and come down, and then do that in standing? So how can you get that person? Because if he stood here and his first step was here, if he didn't have a wider step here to turn, so you can increase his step width and give some cueing. But if he went here and went right into the turn, that would be that crossover step. So training somebody to be aware of that in the beginning so that they're safer, and then also working on the stability with that crossover step. So we did that, but we also worked on a lot of axial rotation. So I'm going to show you in the chair, you can have one station set up that I actually put I wonder if I put it this way. You guys let me know if you can see me better if I switch. So I put the wall mat along, and you could probably even do it with just the floor mat on the chair here. And then here, they would have to find the clicker or hit different targets to get that rotation, so you're getting more rotation. So you can go here and then click, and then get that further rotation. So that could be a beginning of a circuit for just prep work of getting a rotation and having a target and a visualization of where to go. The Parkinson's Safe PDX program also looked at somatosensation. So we know that we want side bending with rotation so you can also moving something down and coming back up. So you can be working on some side bending and then coming here. And right now I just put a little Velcro strap along the edge of my chair, and then I'm feeling this. And here I can feel how far I go versus me just maybe doing this. Now I'm going to go a lot further when I can actually feel where I'm going. So just, this is what we worked on, and then we did it in standing and then worked toward a turn. So if you're going to make your circuit, and I tend to like circuits more, I've been doing it more with my clients as home programs in the gym, even one-on-one in the clinic. Make it meaningful, right? You want them to understand why you're working on this. Then what I like to look at is sometimes I'll do like a theme. So maybe I'll do one task. We're working on getting out of the chair like we just talked about. And the first circuit is going to be that first component of some rotation, opening up the hips. The next one is stepping, and then the next one is the full. So you can make it each one for 30 seconds and then go again, or you can do different tasks. So one could be step turns, one could be predicted turns. You can make each circuit a different aspect of it. You're going to look at your dose depending on your clients, how many reps, how long they're going to do it, what's the frequency. This next part, working with partners, a group or alone. So sometimes in my exercise classes, we'll do a circuit and the whole group goes together, but everyone just stays in their one position. So we'll do, stepping exercises, sit to stand with a step, and we do it 30 seconds, and then we go and repeat it all. And then other times we'll do it stations going with partners or by yourself. So there's different ways to do your circuit depending on your group. Provide autonomy. I think this is so important. I did not do this in the beginning of my career. I used to just tell people what to do, right? I was like, this is what I think is good for you. If you give someone choices, the research supports they will do better. So maybe if it's a sit to stand with a step, maybe that's the goal that you wanted. I will give 3 different choices. You can do sit to stand with a punch and step around the clock. So you're doing all different angles. You can do just sit to stand, stepping to 3 o'clock. You can give them different cues. You can just be working on in sitting and getting your rotation of your legs. So having the same concept, but giving them 3 choices empowers somebody that you're not just telling them what to do. Establish success and add challenge. So knowing that progression. So once somebody's able to do it, then can you add that next piece to it? And then all the different boosts. So boosting with feedback, doing auditory, visual, tactile feedback. How do you get that person to perform better? Is it with positioning of the foot pads so that their step width is better? Is it to get hearing the clickers so the speed is better? Are you giving them analogies? The one analogy I give that I thought was brilliant for my daughter's soccer coach was open the door. So to get that external rotation, open the door, close the door, open the door, close the door. So you're instead of saying point your toes to 3 o'clock or externally rotate your hip. So thinking of how do you boost that a little bit more. I go into the course in a lot more detail, but looking at mental practice and mental imagery. So maybe having one circuit that they sit down and they picture that perfect turn. They're still lighting that part of their brain. So that could be their resting part, that they sit and have a script in their head or read a script that's in front of them saying, I'm strong and balanced. I turn with stability and smoothness, and have all those positive words so that they're doing that maybe in a certain environment. I showed in the course, and I showed this to my class, Fred Astaire dancing, if you just watch how he glides, so thinking of getting that positive image in the head is really important. So looking also just to boost it, if you, I had a client who told me he always bumped into he comes out of the bathroom and then makes this turn around the bend of his hallway and kind of just bumps his shoulder all the time. But realized it was only when he was about to walk the dog early in the morning and didn't turn on the light. So do you add that sensory piece to it? You know, how do you look at what part is causing that person to lose their balance or not do that? Also looking at stepping to different surfaces. So using the different foot pads. Is it a curved from maybe walking the dog, getting pulled in different directions while you're doing it? So kind of thinking of really matching that goal to that exercise, you know, so while they're turning, do you have TheraBands that you pull them and then they're still trying to hit that target? There's different ways that you can add that. So another thing, this is the rate of perceived stability. This is a handout that you can just download on our website that looks at, you know, how hard is somebody working, just like you would do the rate of perceived exertion. So you're looking at, are they, is that balance level at the right difficulty? So I talk to all my clients in a circuit. If this is too easy, then add this. If this is too hard, do this. So them letting them know if an exercise, if they're doing one that maybe a narrow stance on the foam foot pads with head turns, then you can say, okay, then move the foot pads a little wider because you're not there yet, or move them a little narrower because it's too hard. So knowing, teaching them that they can change and make it at their level is really important. So if everyone wants to stand up for head turns, and we're gonna just do, we're not doing a VOR or that type of head turn, but if you're doing full head turns, a lot of clients, when I say just a head turn, I see something, especially in a group exercise class, sometimes when you have 10 people, you see such a wide variety of what people, how they perceive when you say head turns. So I want you to just, all I told you to do is stand with one foot in front of the other and do a head turn. What would you do? All right, so just do, and I don't want to demonstrate, I just want you to do a head turn. So see what your balance is with head turns. Right, so are you stopping in the middle? Are you paying attention to your speed? So that can also make a difference. If somebody loses their balance, it's our role to tell them where is that level. So try the difference of turning to the right, returning back to the center, turning to the left, returning back to the center, versus a full head turn, and see how that changes. And then change your speed. How does that, what does that do? So all of that might change someone's stability. They might say, I lose my balance every time I turn my head, but you might be able to say, well, you're turning a little too fast. Let's start at this level, then let's speed it up. Now let's get faster, let's get faster. Or the same thing, let's return to center. Now that you got that, now try to go a little bit further. So you can really boost with your cueing on how someone's doing versus just saying head turns. So here's another circuit that you can do on looking at all those different parts. So you might start with the stretching that I just showed you on the going around and hitting the targets in sitting. You can do the same thing in standing. So telling them that the first part of the circuit is all prep work. We're getting axial mobility, maybe doing a lot of eye boost. They're looking all around the room, looking and then turning to face something, or hitting different targets to help them break that segmental and block type of motion. Maybe your second circuit is doing hip strengthening. So we do some speed skating. You can set up the foot pads for sidestepping a lot of different ways. So you can show them, I'll show a few different ways. So you can show them with it set up just side to side. So you're doing a step side to side, right? And you're hitting the clickers. You can also then have it just in this direction, or you can do it in the transverse, right? If you want to work. Also hold and then step back and hold. So you can really change whatever you're working on the hip stability. I've also done, if you bring this a little wider, bring this forward, say you want to work on their stability with a crossover step, and they cross and find that clicker and come back. Find that clicker and come back. So you can be working on different ways to get that stability in your second circuit. A third, you can be just doing your step turns that you saw before. You can change it at different speeds. And then you could do a walking task. So another thing to think about is if you have different stations, make sure that they're active the whole time. So rather than just making that station and doing that exercise and then they just walking to the next, if you're really cognizant of where you put the stations, maybe they have to do a 90-degree turn to get to station 2, but station 3, they have to do a 180-degree turn. And then to get to the next station, they have to do a curved path. You know, so if you place the stations at different parts, then they're getting practice on all different types of turns. So here would be an example of some circuits. And I don't have, my group class still is doing telehealth, so I don't have new videos of the group doing some circuits. So here would be the first one doing the turning. Here would be a second one, you would be doing 180-degree turns. I have the foam foot pads, and then I have just the plain textured foot pads there. And for this, they have to just switch positions, and the goal was to see who can get in the chair the quickest. But this was to work on making sure there was no overlap strategy. So if you look at the tug, when they're going, I wanted them to make sure that they're on the foot pads facing forward before they sit down. So think of that client who rushes to sit down and they kind of, you know, I don't know, there's some articles that call it distinct versus overlapping. So you see a client that does this, maybe they go here and then they kind of, they don't finish that turn before they sit down, right? They kind of just overlap and sit. So you want them to fully finish that turn and then sit down, was my instructions for them. So that would be the maybe one, where the second one would be here.
Something white. Quick, as quick as you can. 4 things white. Go. Good. 4 things green.
Got it.
4 things.
And then, so here he was scanning to go quick all around. And then this last one would be another circuit. So there he had to do a step turn, practicing the stability, and then go a step turn, and then go do a curved path to go around the mat. Here, I would actually, if you have a wall and a floor mat, you can actually put one forward and have another foot pad there to tell them which one to start with, because if not, they might actually do a crossover step unless you want to. So you kind of have to look to see how you would set that up based on the client. So another way that you can work on is maybe having one circuit that you're doing 90-degree turns with the clicker foot pads, and then another circuit with the foam foot pads. So you can change and have different surfaces, where the second circuit would be maybe varying their speed of their turns. So they would practice going at their comfort zone, going faster, and then looking at the different types of steps. If they're doing a narrow turn, maybe you do it in a corner or somewhere that's really tight that they would have to get used to, versus somewhere a little bit wider. So I'm gonna stop this share. So here, if you want more information, we have a course now, and we have 2 live courses. There's some people from the Kansas City group who went to that first course. So if there's questions, please let me know and email me. But right now I'd like to open it up. I'm gonna stop the share here. And if there's questions, I just see one. I will send the slides if people want the slides. That will be helpful for anybody. But if there is any questions on just turning, or if somebody doesn't have the mat and has questions, I also had, I didn't put it in there, but there's 4 circuits. I did a group exercise class that people came and did the exercises online when everything was going on with COVID. And we did like just on the mat. So they did a whole circuit on the ground, then they did a whole circuit just lateral stepping and side stepping, and then another one all forward. So you can also be pretty creative and keep it all in one mat versus having stations. So it depends on what you want to do. But yeah, I'd like to open up if anybody has specific questions on exercises maybe they're trying already, or exercises that they're unsure about, or just any questions, I'd like to open it up. So one question is it necessary to always train spin turns? Any patient situations where you don't recommend training those? So yes, spin turns are definitely less safe. So if somebody doesn't have, especially the vestibular system, if they can't control their center of mass and be able to turn at that speed, I would recommend doing more compensatory and saying, this is where I'm going to be training you to do step turns and to slow it down. The problem is, and I don't know if there was any researchers in the group, is to know, would that just happen in everyday life though, right? So we can tell somebody, try to avoid, just like people say, avoid dual tasking. Are they that cognizant of every turn that they make? I would think not, so I think that's the hard part. But if you can train to make sure if they had a choice and they were thinking of their turn, especially if they were slower, then I would definitely do step turns as much as I can for that. But maybe starting to work with them with head turns and in a narrow stance and being able to get those components until they can actually do that full spin turn. If they were doing the spin turn and you were training it, I would train to try to increase their stance width so that they were actually, because as they turn, if you step with a wider stance, you're going to have more stability. Any other questions? You guys are quiet.
Erica, when you're having people stand in and out of the hula hoop,
Yeah.
is it for total weight shift? Is that what you're trying to achieve, to get their head over to the very outside versus very inside of the hula hoop?
Yeah, so I'm just looking at their center of mass, where their head is in relationship to their, like how they're moving. So if like you can do it with the clickers or without. So like if I even did, even thinking of the stepping strategy, I do the same thing. Think of somebody who does the Clock Yourself app or something, who steps, who doesn't shift their weight, right? And they kind of just want to be here, So even if they're turning around something here, and I just want to be here, do you see how like I'm staying in here, right? So if I keep doing this, I'm gonna have a harder time to be able to take that step. I need to shift. So to be able to tell them to shift out and then back in, they're getting just a better control. So it's just a visual cue of where to go, because a lot of people don't pay attention to their head, of where their head is. So does that answer that?
Yep, thank you.
Is there any exercises that people do with turning that would share with the group to other people to learn that they like? No? Or what does everyone do for turning?
A
No.
lot of what you did, we follow your lead.
Yeah. I thought someone was saying, no, I think it's an interesting thing, because I think, we train and we assess so much straight path walking, but that's not our everyday, or even thinking about a client who exercises and walks around a gym, and they have like it's just like an arc, where they go around a track. What is their stability? My favorite is an Easter egg hunt was from Vestibular First. They find hand weights I've hidden around the room. Yeah, so that definitely is going to have them quickly turning and changing and looking, especially if they want to find who wants to find the most, right? You can add that speed component to it. I know what my kids were looking for eggs. That also, there was a study actually that would be good on attention and searching, because looking at how there's a increased risk for falls if somebody's attention isn't there, right? So if they're not attending and looking and scanning around their environment. So being able to, I used to hide a few different things and have them find it the quickest, but being able to turn and find and walk. But then giving people those cues, don't just let them keep doing the same thing over and over, because then, anybody can do that. We're all above trying to give them those different cues. But I like the hand weights also, so then they have to grab the weight and also work with strengthening. I like that. But yeah, if there's any questions on just, this is something that I'm going to start opening this up to people who took the course to be able to review some concept, review some exercises. So if there's an exercise you're doing or you're feeling like, oh, this isn't working with a client, or I want to review this with, what type of exercise should I do in this situation? I'm happy to help you guys with that, because that's the one thing as a clinician. I invented this tool, but I read the research and try to translate that to say, how can we actually apply this with our clients? Let's see, anything else?
Erica, one of the men that I trained fell probably about 3 or 4 months ago, but the doorbell rang and he got up too fast and swung his leg over. And we had a discussion about when things happen, the dog barks or somebody slams the door and you get up and do something quick, that period of time is a real, the time that you can fall. That's a dangerous period of time, that first second, that first step.
And I think exactly what you're saying is that, so, having that conversation of, when he has predicted type of turns, when he knows he has to, just go to the bathroom and there's not that unpredicted and that speed.
Yeah.
Is the two things that cause him to have an increased risk of falls. So that's where I would start training to say, okay, we're going to train you at this speed. So I'd even use the metronome or music, having them turn back and forth, and then start to go quicker and quicker to see what is that speed that person could do. Because unfortunately, like you said, we can tell someone as much as we can to be, okay, don't do this. But if all of a sudden something looks like it's going to fall off the kitchen counter, we're going to go quickly to try to get it. And our body just doesn't have that stability yet to be able to react that fast. But yeah, I think this is where I think our role is to be able to help looking, okay, we're going to do a lot of unpredicted. When you hear that sound, you're going to turn to that sound and step, or kind of play around with that a little bit. Is he doing better?
Take a deep breath before you move.
Yeah.
Telling them just take a deep breath before you do anything.
Yeah. Did that help? Is he doing better?
I haven't been doing much turning. I've been on the mat and I've been going forward and back mostly.
Yeah.
For the length of his gait. So he's got a problem. He has can't see my feet, but he's scared to death of falling. So
well, if he had a fall, that's understandable. So
he walks. His eyesight's okay. He's frail, but I mean, he doesn't have. I measure his steps, and he's about. This is about max right here. Max.
Yeah.
If he needs to, and then he does have hip problems, flexibility problems, but I mean, when I talked to him, and we did walk around in a circle, and when we talk about stuff like golf or whatever, his kids, his grandkids, suddenly his gait gets longer. He relaxes.
Yeah.
Have you seen that? Now, if you kind of coach him and say, okay, now be careful, don't be, and he'll shorten up and get scared.
Yeah. And that's where that component, so giving him that confidence, that saying, wow, you did great today, talking about that is going to be like key to slowly keep ramping that up. I've also did similar types of things that when you're like seeing somebody get that tight, that distraction is really important. So I've even had people tossing, not a ball like that you're trying to challenge their visual, but having them just like pass it just back and forth. It kind of relaxes the trunk. And then they're not so here using the wrong strategy. At first they think you're crazy because you're like giving them another task to do, but it actually relaxes and most people can do better as long as they're not trying to catch it. It's just passing back and forth. But that might even help a little bit.
Yeah, that's a good idea. Thank you.
Yeah. But yeah, definitely reach out if there's more questions on it. Another comment is working with kids, they do a lot more turning naturally, I think a lot more than adults do. Rotation with planted feet, head turns, dancing. Yeah, I think dancing even for adults, I think is a fun way to add all those different movements, those different directions. So you can even change the foot pads if you wanted to do actually step length so that they're getting the proprioception. You could do the box step or different turns in that aspect. But yeah, I think kids are a little bit quicker too, right? Trying to check everything out. You know, but also looking if a child is initiating with the head, is there ways to kind of get some of that rotation a little bit more? Anything else, anyone? If there's questions, please email me. It's erica@stepandconnect.com. And let me know if this is helpful, just to have some of these little mini sessions on just different exercises. We could pick a topic and kind of go over. I know turning was just something that people were bringing up, but there's vestibular exercises people can do. There's just, you know, jumping. There's so many different things that you can utilize. Anything else before we go? It's late, depending on where you are, right?
It's late.
Well, thanks everyone for joining. I hope this was helpful. But yeah, let me know if there's any articles or things that you would like. Otherwise, we call it, just email me and we can review. All right. All right. Well, have a good night, everybody. Thank you.